Okay. Good morning and welcome to the November meeting of the Seniors Council of Douglas County. My name is Gretchen Lopez. I'm the chair of the Seniors Council, and it's my great pleasure to speak with you today. Before we start our program, however, I'd like to express our sincere appreciation to Douglas County and our county commissioners for their support in providing the technical expertise we need to conduct these meetings. For this, we are forever grateful. I'm so excited to share with you all the wonderful activities and programs available to you this month, plus some opportunities for you to offer your input on upcoming community developments. So you may want to have a pen and paper nearby to take notes and/or jot down some questions. We'll have time at the end of our presentation to answer any questions you may have. Well then, let's get started. Have your calendar handy also, because coming up on Saturday, November 14th, from 10 a.m. to noon, is the Drive-Through Adult Health and Information Fair. The Highlands Ranch, Metro District, and Home Care Assistance have teamed up this year to offer this new approach to helping us stay connected to local resources. It's free and you do not need to register. Just hop in your car for a short ride to the Metro District's parking lot at 62 Plaza Drive in Highlands Ranch. Again, that's 62 Plaza Drive in Highlands Ranch. You'll receive a tote bag full of valuable resource information and fun giveaways, so don't miss this event. We're all struggling with COVID, and we're starting to become, again, safer at home. But did you know that Douglas County has emergency COVID-19 assistance funds available to individuals and families? If you or someone you know is struggling to pay for housing, transportation, utilities, food, or medications as a direct result of COVID-19, there may be some help for you. Applications for these general assistance funds are being accepted now through December 15th through the Douglas County Human Services offices. If you have any questions or need help completing the application, you may call their number, and it's 303-688-4825. Again, with help with the COVID-19 emergency funds for information or help with the application, you may call 303-688-4825. Now, there's also an opportunity to impact our community in a very special way. The town of Castle Rock is inviting feedback by November 20th, so just about 2 weeks from now, on its renovation plan concept for the Butterfield Crossing Park. For those of you residing in Castle Rock, you can make a difference by completing their survey and offering your input. I took the survey and noticed that the plans do not include any adult outdoor fitness equipment, so I added that suggestion in the comments section towards the end of the survey. Even if you don't currently enjoy this particular park, you could be instrumental in introducing a more age-inclusive approach to our outdoor living experience. There is outdoor fitness equipment specifically designed for older adults, which is intended to maintain our coordination and balance. If there are enough surveys requesting this type of equipment and this suggestion is accepted, it might be the first step in expanding the outdoor playground experience for all of us and encourage other Douglas County parks to do the same. Phased renovation work is scheduled to begin in 2021, so it's not too late to help get this idea in front of the decision makers. Just remember, you have to complete your survey by November 20th. What an exciting thought. If you'd like to participate in the survey, you can find it on this particular website. I hope you can read that. It's crgov.com/survey. It's a relatively short survey, and in the comment section, if you'd like to agree with me that we'd like to include some fitness equipment for older adults, then by all means, find that and complete that by the 20th. One more item before we move on to our education report and speaker. I recently connected with a nonprofit organization located just north of us in Denver called Wish of a Lifetime. Jeremy Bloom, former NFL player and world and Olympic champion skier, talk about an overachiever, huh? Founded this organization in 2008 in honor of his grandmother. Its mission is to shift the way society views and values our oldest generations by fulfilling older adults' dreams and sharing their stories to inspire those of all ages. There's no charge for the wish to come true, and the only requirement is that the recipient be 60 years or older. Anyone can submit a wish for a deserving older adult. But keep in mind that because of COVID, Wish of a Lifetime is focusing right now on virtual wishes and wishes that can happen safely within our homes. So if you have a deserving older adult that hasn't seen a sibling in a long time, or would like to connect with family overseas, or would like to take a trip to Italy through a virtual headset, all those things would be something the Wish for a Lifetime would consider. If you visit their website, wishofalifetime.org, there are videos of all types of wishes that were granted. You'll meet Donald, a lively 95-year-old whose wish it was to fly in a glider. Then there's Bertha, whose dream it was to be an actress. So in partnership with Crest Oral Care, she was given an acting part in a short film, Sharing Cookies with Santa. It was so cute. And at 86, Mary's lifelong wish was to experience a hot air balloon ride. And there are many, many more heartwarming stories like these. So check it out for yourself. Again, it's wishofalifetime.org. Their website has lots of information about them. And now we're ready to hear from Tiffany Curtin, our education chair. She'll give us a sneak peek at our upcoming presentations and then introduce today's speaker, Jean Anhalt. Tiffany?
Good morning, everybody. It's nice to be this month. So upcoming on our schedule for our December meeting, we will be hearing from Joyce Fustel, and she has her company, Boomer Social Media, and she will be giving us some great tips on staying safe while using social media, especially focusing on Facebook, as well as some tips on how to make the most of what we do on Facebook and using that for engagement and connecting with our friends and family and expanding our connections through social media. And so we're looking forward to that. In January, my colleague Allison Evans and I will be presenting a little bit of information about how to evaluate information on social media like Facebook, giving some tips and tools, a lot of anxiety about what we can trust when we're using social media. So we'll be presenting some tips and tools for you to evaluate the information that's coming to you through social media resources. And then in February, we will have Kate Reed from Move More and Be Well is her business, talking about some ways of staying physically active and staying well, and whether we're in a shutdown situation or not, and just keeping ourselves mentally and physically healthy and active. And because I'm going to jump ahead a little bit, we are looking at having a speaker from the Wish of a Lifetime in June of 2021. So it's a bit of a jump ahead, but I don't want to go through the full list. But since Gretchen gave us that little teaser about Wish of a Lifetime, we are expecting to learn more about that organization and how you can become involved in that in the middle of 2021. So exciting stuff, but that doesn't mean you should wait to check out their website until then. And so that's our upcoming speakers that we have in the near future. And right now, I would like to introduce our speaker for today, Jean Anhalt. She is a SHIP counselor with DRCOG and has been there for 4 years in that position. She has also served as a SHIP counselor and benefits eligibility specialist with Centura. And prior to her current employment situation and working for Centura, she was a SHIP volunteer for several years prior to where she is now. So she definitely has a lot of expertise, and we ask you to welcome her as our speaker. And I'd like to introduce Jean Anhalt. Now to you, Jean.
You are muted, Jean.
See.
There you go, Jean.
Okay. Okay. Can you hear me?
Yes.
I've not got much information on there we go. Okay. All right. So if everything is good. So, right, I'm a SHIP counselor. Thank you for that introduction, and thank you for letting me be here. I really appreciate it. Kind of spread the word about what's going on with Medicare right at this time of year. So, SHIP counselors, just to ground you a little bit, they're funded and trained by the United States Department of Health and Human Services and the Colorado Department of Regulatory Agencies. And their SHIP counselors are trained to teach you how Medicare insurance works and give you information so that you can make informed choices. SHIP counselors are available to you year-round to answer questions about Medicare and Medicaid, suspected insurance scams, and billing issues. But there are certain things that we do during the annual open enrollment period that we can only do during this period. And that's what I'm going to talk about, is those things. So first slide. I don't have a visual on what's happening. Are we on the first slide? There we go. There we go. Okay. So this is about what SHIP can do for you during the Medicare open enrollment period. All right, next slide, please. Okay, so first, let's talk about what we're going to cover. So we'll talk about the changes that you can make in this open enrollment period. We'll talk about the importance of reviewing your current coverage, factors that, it's important to know what you have before you make a change to it. We'll talk about factors in deciding to select a certain prescription drug plan during the open enrollment period, factors in your decision to select a certain Medicare Advantage plan, and talk about how to make changes to your coverage. And then I want to also talk briefly about some other enrollment periods that are coming up that are probably going to affect a lot of people. Then we'll touch briefly on agent and broker do's and don'ts, and I'll give you some resources and contact information for us. Next slide, please. So going to the very beginning, Medicare is health insurance that's provided by the federal government. It's known as Original Medicare. So these parts, you'll see on this card, there's a Part A and a Part B. Those are known as Original Medicare. You enroll with them through Social Security. This program is administered by Centers for Medicare and Medicaid Services. And when you enroll into Medicare, you get a card that looks like this. It's paper. And you'll see that it has your Medicare ID on it. It also has the start dates for your Part A and Part B. So this is a keeper. You might not want to carry this with you in your wallet unless you need to show it to your doctor, but do keep this card. Okay, next slide, please. So with Medicare, there are different ways to take your coverage. You need to kind of check 4 boxes as you're thinking about your Medicare coverage and reviewing your Medicare coverage. Okay, you need to make sure you have hospital insurance. Okay, that's your Part A, done. You need to have Part B, medical insurance. That's your Part B, so that's done when you enroll in Original Medicare. You need drug coverage. So I'm skipping over Part C right now. You need drug coverage. That's Part D. It's a letter in Medicare that actually corresponds to a word, so we love it. Part D, drug coverage. And then the other thing that you need is a spending limit on your copays and coinsurances, because Part A and Part B, they cover a great deal, but they don't pay for all of it. There are deductibles and there are coinsurances and copays. And the federal government establishes no limit on the amount that you can pay. So one of the ways, we're going to go look at the Part C bit now. That's one of the ways of establishing a spending limit. The Medicare Advantage plans bundle Parts A, B, and D, and they also give you a maximum out of pocket. Let's go to the next slide, please. Okay, so now the other way of doing the other way of establishing the spending limit is a Medigap plan. So these plans are also called Medicare Supplement Insurance. I'm going to keep calling them a Medigap because the word supplement gets a little confusing. So Medigaps, these serve as a secondary payer to Medicare, and they're a way of establishing a spending limit to your original Medicare. To join a Medigap plan, you have to have original Medicare, which is A and B. And then you, by the way, you can't have a Medigap and a Medicare Advantage plan at the same time. The Medigap plans range in letters. They're different plans. They go from A through N. The most common ones are F and G. People commonly will call their Medigap plan my Plan F. So that's changing a little bit. We'll talk about that. The amount of coverage you receive depends on the letter plan you enroll into. And depending on the Medigap plan that you chose, you might have all or most of your Part A premiums and deductibles, copays, and coinsurances covered by the Medigap plan after Medicare pays its share. So it's a secondary payer. Okay, so you've got A, you've got B. You will have to sign up for a prescription drug program separately. And then the Medigap would establish your spending limit. So let's go to the next slide now. Let's see. So this is an overview slide of the 2 ways to take your Medicare, and we're still getting grounded in what you have. It's good to know what path you're on before you start changing things around. The top path, okay, we'll talk about this in terms of what cards you might show to your doctor or your pharmacy. Top path, okay, so first time you go to your doctor, you'll have original Medicare, Part A and B, that red, white, and blue card. You'll show, your doctor will want to see that at the office. The doctor won't care. Then you're going to need to pick up prescription drug coverage, Part D, and you'll get a card for that, separate card for that. The doctor won't need to see it, but your pharmacy may. Then for your spending limit, you get a Medigap supplement, and there'll be a card for that as well that your doctor's office may want to see. Right. Second, the bottom path. All right, so here's where you take a Medicare Advantage plan. These are plans sold by private companies in contract with Medicare. They bundle A, B, and D. Okay, so now you've got hospital, doctor, and drug. And within the Medicare Advantage plan, one of its features is it gives you a maximum out-of-pocket spending limit. In some cases, this particularly applies to veterans. There are some Medicare Advantage plans that do not. So prescription drug coverage for the VA is very good, and you could potentially combine those, get prescription drug coverage for the VA and have a Medicare Advantage plan that only has A and B in it. This is unusual, you know. So, but I did want to mention that for veterans. Okay, let's go to the next slide. So let's see. Okay, so now to the annual open enrollment period. We're a couple of weeks into it. It goes from October 15th to December 7th every year. And during this enrollment period, here's what you can do and what we can help you with. You can add or drop or change your Medicare Advantage and Part D plans. There's no penalty for any changes that you make during this open enrollment period, this particular period. And there are no, you don't need to be concerned about pre-existing conditions affecting your enrollment into any of these plans. So if you enroll, you make your change during this enrollment period, your plan is going to go into effect January 1st. The change that you make, if you sign up for let's say you sign up for a different prescription drug program, that enrollment is going to automatically cancel your previous enrollment. You can only have one Medicare contracted plan at a time. And this is a good thing. So you don't have to take separate action to disenroll from the old plan. So that's different. If you have a Medicare supplement Medigap plan, and you decide to get off that path, instead you want a Medicare Advantage plan, enrolling in a Medicare Advantage plan is not going to cancel you out of your Medigap. You'll have to do that separately. All right, let's go to the next slide, please. Okay, so let's see. Your first clue, you're already in Medicare, you're going to get something in the mail. You should already have it by now. There are two documents that are going to come to you separately this year. The one is the annual notice of change. So that's going to tell you for the prescription drug plan, drugs especially, you're going to want to look and see if your drugs are still on the formulary, and if for both plans, if your premium has changed. It could have changed. The deductible might change, and you know, pay attention to that. Then the other document you're going to get is an explanation of your coverage. That's a long reference document for you to keep that explains your plan in detail. Okay, let's go to the next slide. Okay, so now we're to factors that affect your decision in terms of what you're going to do. Let's say you want a prescription drug plan. Sometimes we call these standalone prescription drug plans because it's only a drug benefit. It's not a health plan. Just covers prescription drugs. Okay, so of course one thing is going to be the formulary, which that just means the list of drugs that are covered by the plan. That'll be listed in your annual notice of change, and SHIP can also help you with that. So you want to make sure that your drugs are on that formulary. You want to look at what your premiums are going to be for 2021. For standalone prescription drug plans, there's quite a bit of play in those premiums from year to year. So do pay attention to that. There are changes in premiums for Medicare Advantage plans too, but I'd say there's more play in the premiums for the prescription drug plans. The deductibles will change. For 2021, the highest deductible for a prescription drug plan is $445. There are some plans that have zero deductible. So your payments for your prescription drugs during the year are going to be based on your plan's deductibles we've talked about, but also the tiers. So drugs are sorted into tiers 1 through 5, with the lower number, the number of the tier, the less it costs. So tier 1 would be a preferred generic. Then you as you move up, you have preferred generic, brand, preferred brand, specialty tier. And the specialty tier drugs all cost over $800 a month. So the drug plans, I mentioned this because the drug plans have some latitude in assigning the drugs to tiers. So depending, one drug plan might have your drugs on lower tiers than another, and that's going to affect how much it costs you overall. The plans will also have copays or co-insurances. They have some play in establishing those. Those will be different from plan to plan. And then also the plans have different pharmacy networks. Your pharmacy might not be your preferred sorry, I shouldn't use that word. The pharmacy that you like, that you've been using, might not be a network with a plan that looks good in all other ways. And if that's a deal breaker for you, that's going to affect your decision on what prescription drug plan you take. Okay. Now, I should explain too, going back to formulary, if your drug is not on a planned formulary, that means that you pay full price for the drug, with some exceptions. So the ship counselor will help you sort this out. But there's some situations where people will have maybe 15 or 20 drugs, something like that. It can be tough to get sometimes to have all your drugs on your plan formulary. And then there's some things that we can counsel you around that. Some things to do to take care of that situation. Okay, another thing that affects your prescription drug costs is the coverage phase that you're in. So there are 4 coverage phases in a prescription drug plan. The first is your deductible phase. So remember, a deductible is what you pay before the plan kicks in. So with a prescription drug plan, you're going to pay, if your plan has a $445 deductible, you may have to pay retail cost until you get up to that $445. I say may because sometimes that deductible is waived for preferred generics. You may pay $0 if all your drugs are preferred generics. You may pay $0 for them. So you can't, don't assume just because you've got a plan with that $445 deductible that you're going to be paying that much out of pocket before the plan kicks in. Okay, so there's the deductible. There's so there's the deductible phase. Then there's what's called the initial phase. That's when the plan kicks in, and you pay, generally speaking, they're allowed to charge you 25%, but a lot of times it's going to be less. There'll be a copay that's less than 25%. Now, after you've spent, and the plan has spent a great deal of money to the tune of $4,130 in 2021 for drugs, you go into what's still called the donut hole. Or you think of it as a coverage gap. So while you're in that phase, you're going to pay 25% of the price of your drugs. It's probably going to be more than what you were paying in the initial phase. That's the same for branded generics. You're going to pay 25%. The next phase of coverage is called catastrophic. And I think I should have saved that word for the end, because the catastrophe is not for you. The catastrophe is for the drug insurer, because after you pay a certain amount of money, now your cost is going to be 5%. Generally speaking, it might be a little bit less, but it's going to be 5% or $4, whichever is higher. And for brand, it would be $9 or 5%, whichever is higher. So at any rate, this is complex. This donut hole thing is complex. This is one reason why you consult a ship counselor or learn how to use the Medicare Plan Finder tool, because it can, if you have a lot of drugs and they're expensive, you might hit that donut hole, and you can we can show you what your out-of-pocket costs are going to be in each month of the year, so you can kind of plan ahead. And you can also strategize a little bit. Like it might be better for you to take a plan that has that gets you into the donut hole faster so that you can come out, if you're going to come out on the other end into catastrophic coverage, that would overall cost you a lot less. And so you can, I hope all I've it's not impossible to do this. It's just really complex. And that's why we have this plan finder tool that's available for us to use for you or for you to use for yourself. Okay, let's go to the next slide. Talk about Medicare Advantage. So, oops, I skipped some things. So there's prior authorization is something you might want to consider too. Some drugs require prior authorization from the doctor. There are some drugs that have quantity limits and some drugs where you might be required to try a lower price drug or a lower cost drug for the drug that you'd like to have, and show that doesn't work before you're allowed to use the drug that you would prefer to have. Okay, let's go to the next slide. Okay, so then another factor is the pharmacy. So they're different. Your pharmacy, if it's in network, it may be a preferred pharmacy, and that's what's going to save you the most money. So the preferred pharmacy would, standard pharmacy would be in network, but a preferred one would have a special contract with that drug insurer to provide you the drugs at less of a cost than a different pharmacy. Another thing to consider is mail order. I don't have that on the slide, but a lot of times you can save money through mail order pharmacies. Not all prescription drug plans offer that, but most of them do. And if you're comfortable with that, that's something to consider. Generally speaking, when we run a drug plan comparison for you, we'll include options for a lot of different pharmacies so that we can make sure that you can see the differences in cost between mail order, preferred pharmacy, and a standard pharmacy, in case it's possible for you to change your pharmacy in order to gain some cost savings. Okay, let's go to the next slide now. Okay, so now decision-making about Medicare Advantage plans. So again, just a short review. These plans bundle together your A, your B, and your D. And you get this coverage through a private insurance company that's in contract with Medicare, also regulated and subsidized by Medicare. And these plans frequently have no additional premium. And I say additional because you still have to pay your Part B premium. That's $145 a month, $144.60 a month. But because these plans are subsidized by the federal government to take care of you, you could very well get a very good plan for zero additional premium. So this tends to be an economical option for you. So they kind of work similar to an employer plan where you need to see doctors in their networks, generally speaking. Some of these plans offer incentives, like some dental benefit or vision benefit, exercise benefit, hearing benefit. There are some plans the plans are really expanding the amount of extra benefits that they offer. And so those things might be very important to you, and those things change from year to year a great deal. So that's something we could take a look at. All right, let's go to the next slide. Let's see. So, okay. Incentives. Okay, so now there are different kinds of Medicare Advantage plans. I mention this because one of the main concerns with choosing whether you're going to do original Medicare plus Part D plus Medigap versus Medicare Advantage is is whether you travel a lot, whether you live in the same region all the time, because Medicare Advantage plans they're regional. They have a fixed area that they serve. So if you're spending a couple of months a year visiting, living with children or traveling outside of your state, then you might want to consider one of these other types of Medicare Advantage plans. So traditionally, the way to handle this has been, you take original Medicare and a Medigap, and you can travel all over the country and see any doctor that takes original Medicare. So more and more we're seeing PPO plans being added on to the menu of Advantage plan possibilities. A PPO, the words don't tell you much. It stands for Preferred Provider Organization. But what it means is that you can see a provider that's not in the network with the plan if you choose. You wouldn't have to get a referral. You could go there, see that provider, and if they take that plan, then you would pay. You would still have a co-insurance, which would be higher than if the doctor was actually in network with the plan, but it would be affordable, or could be affordable. You'd also have an out-of-pocket max for that expense. So that's one thing that's kind of people are considering as an option if they spend a great deal of time outside the region of their plan. Typically, plans are HMOs, and that you can see what that stands for. It's Health Maintenance Organization, but it means you have to choose a doctor in their network. You're going to have to get a referral to a specialist most of the time. There are exceptions to everything. Or else you're completely uncovered. You'll have to pay the asking price, which is, insurance. The asking price is very, very high. We can't make much sense of the asking price sometimes. You need an insurance discount to afford health coverage. So then moving on to private fee-for-service plan. This is another type. These are kind of rare, but a private fee-for-service plan, let's say your provider is not in the network of this plan, you could go see a doctor that takes original Medicare, and you would have a copay or co-insurance for that. That would be the original Medicare copay, or it'd be higher. I think I just misspoke. It would be higher than what you would pay than if the doctor was in network, but not the asking price. And you would have an out-of-pocket maximum. And then the other type of plans, special needs plans. There are a lot of these there's different types of special needs plans. The most commonly sold ones are for people who have both Medicare and Medicaid. And these plans tend to be very rich in extra benefits, very low cost, zero premium, pay zero for your drugs. Sometimes you could get, there's one that even has a food benefit this year. So this is something to really consider for people that have both Medicare and Medicaid. Then there are also special needs plans for people that are in an institution, a nursing facility, or in an assisted living facility, and also some for people that have certain chronic conditions. I think there's a diabetes special needs plan. So let's see. Let's go on to the next slide then. All right. So things we're going to think about in terms of what questions we're going to ask you if you're thinking about changing your Medicare Advantage plan is did you get your annual notice of coverage? Is there something changing in your Advantage plan? Is the premium going up? Do you know what your premium is? A lot of people don't know that they're paying a premium for their Medicare Advantage plan because they have it set up to come out of their Social Security check, and they forget. I mean, that's why you have it withdrawn, so you could forget about it. So a lot of people don't realize that they're paying a premium for their Medicare Advantage plan. And you might consider a zero premium plan. you want to make sure your drugs are covered by the plan. The drug coverage tends to be more stable with Medicare Advantage plans than with standalone prescription drug plans, but you still want to check it for sure. You want to know how the cost, the co-pays, the co-insurances, any deductibles compare with the other plans. Really important is, have you been satisfied with your the doctors that you've been using? Are they in the plan's network? Did they drop out of the plan network? Might they be in some other network? And are there doctors that you've been wanting to use? There are changes from year to in the doctor networks from year to year. I mean, they can change within the year too. But like this year, there's a plan that's didn't previously take doctors from the UC Health system. That this year is starting this year. They're going to do that. So that's a consideration. There's also a plan that's going to stop requiring referrals to specialists. So that's another consideration. Okay, has your coverage been convenient for you? Can you get to your pharmacies and your doctor, your facilities? Do you want to change on that basis? Let's see. And we talked about traveling to locations outside your plan's region. Might you want to change from an HMO to a PPO or a private fee-for-service plan? Okay. Do you have other coverage such as VA drug coverage or TRICARE for life? So if you have those benefits, as I think I pointed out before, you would have some options with taking a Medicare Advantage plan that does not include prescription drug coverage. TRICARE for life. TRICARE for life has prescription drug coverage, but it also is a secondary payer. That's quite a nice one. So you might have, if people might sometimes have a Medicare Advantage plan and TRICARE for life and not realize that they could change to original Medicare if they wanted to, and still have a spending limit. Okay, let's go on to the next slide. Okay, all right. So here's some updates for some changes that I haven't mentioned today for Medicare Advantage plans. There's something called a senior savings model. This would concern diabetics. So there's a voluntary model. Some Medicare Advantage and standalone Part D plans offer coverage of some insulins for a flat monthly copayment of $35. So this is very exciting. So far I haven't, the people who have diabetes whose drug plans I have run it's been cheaper for them to get a different type of plan than this. Their insulin hasn't been on the plans list. Okay, now the other thing is that starting in 2021, people with end-stage renal disease can take a Medicare Advantage plan, any plan they want. This is huge because last year and the year before, there were no Medicare Advantage plans in Colorado that took people with end-stage renal disease, which of course made it necessary for people with this to take a Medigap plan to establish a spending limit. And that is, I think I've mentioned, a more expensive option in terms of your fixed monthly costs. There are also telehealth services are really increasing, particularly, I mean, there are doctor visits. There's been this possibility right along to talk to a doctor. If you don't have to have any physical exam associated with it, of course, talk to a doctor over telehealth. But behavioral health specialists are bringing this in too, and that's covered. All right, let's go to the next slide. Okay, so tools for how to enroll. Let's say you've made your decision. how can you enroll in a different plan? So there's, if you contact a SHIP counselor, we can help you enroll in most Medicare Advantage and prescription drug plans. We can't help you enroll in a special needs plan. That has to go through a national agent. You'd call the plan for that. But we can help you enroll in the others. That's enrollment is fairly easy to do. That's the decision that's hard. It's pretty easy to get enrolled. You can enroll yourself on the Medicare website. There's the slide contains that information. If you go to medicare.gov, and you can call the individual plan to enroll. And sometimes this is my favorite option for people, because if there are a great many doctors and a great many drugs, I find it's safest to call the plan and double check those provider lookups. We'll do that for you. But to be really have the most certainty possible, you want to hear somebody from the plan say, yes, that doctor's in your network. Yes, that drug's on our formulary. And here's how much it's going to cost you. So that's one of your options. Then the number for your local SHIP can be obtained through that number, which is on the back of your Medicare New book. And I wanted to remind you that if you enroll in one Medicare contracted plan, it's going to automatically disenroll you from the plan that you're in right now. And I'm going to give you an example of why I'm reminding about that is that I talked to one person who was had been getting a lot of mail. This time of year, you're going to get a lot of mail about, and it was emphasizing the importance of prescription drug coverage. Well, that's right. That's true. This person had a Medicare Advantage plan that bundled A, B, and D. She had prescription drug coverage, but she didn't know it because she didn't take any prescription drugs and thinks about that unless they have to. So she was getting ready to get somebody to enroll her into a prescription drug plan. Her idea was she would add it on to what she already had. But if she'd done that, it would have disenrolled her from her health plan, and she would have had probably to change her doctors and she would have had no out-of-pocket spending limit, no maximum out-of-pocket. Okay. All right, let's go to the next slide. Okay, so here's some resources. I thought about walking you through the Medicare Plan Finder, but I'll just tell you it's a great tool. We will that's something that SHIP counselors do day in and day out. We can do plan comparisons for you and get that information to you so you can review it before you make your decision. You can also do this for yourself if you feel comfortable with your computer and you kind of like it, try it. It's a great tool, has a lot of functionality, great search function if you just have general questions about Medicare. And additionally, started last year, you can save your drug list in your own account. You can establish your own account on Medicare.gov and enter your drug list in there, and it's going to stay there. You can make updates, but that's to keep you from having, let's say you have 10 drugs, to keep you from having to enter those 10 drugs every time you close your browser. So, it'll save them there. Now, SHIP counselors, those are your accounts. You're going to have a username and a password for that. Right? So that's your account. You can also get your Medicare summary notices early. Generally speaking, those come out once a quarter. Right? You can get them. You can see right away, pretty much what's on your Medicare summary notice, and this is very handy sometimes, as you can imagine. Okay, so then we've got numbers there for 1-800-Medicare. They can do these. They can do enrollments for you. They can help you compare plans. there's yeah, they can, always remember that resource is there for you. And as far as contacting a SHIP program, that top number there, that's a number that's on the back of your Medicare new book. They're going to ask you, call that number, they're going to ask you what zip code you're in, and then they're going to triage you to the place that's your designated SHIP office. You like the DRCOG SHIP is the designated SHIP for Douglas County and Arapahoe County and Jefferson County. There's a different SHIP. There are several different SHIPs in Colorado that handle other counties. Although we can all handle all the counties. It's just that we know resources in our own a lot better than than somebody else's counties. So and then the other resource that SHIP counselors use as well is the individual plan websites. So sometimes if we have these are great for double checking. They're great for provider lookups to see if your doctor's in network. Also great for double checking the cost of your drugs. Sometimes we can't find something in Plan Finder, and maybe we just haven't. There's some drugs that are one drug / another drug / another drug. Maybe in Plan Finder, they have the names put in a different order, and we can find it on the plans formulary. So those are really good resources to use. Okay, let's go on. Got about 3 minutes here. Let's talk about other types of enrollment periods. Okay, so every year we get people during this time, this annual open enrollment period, who have they've gotten this kind of vague message that now is the time to take care of your Medicare. Whatever it is, you better take care of it now. Okay, like I said, there's the things that we can do for you now are to change your D plan and your C plan. There's an initial enrollment period when you first become eligible for Medicare by disability or by becoming age 65. And that enrollment period is based on the month of your birthday. It's 7 months long, with the center month being the month of your birthday. This is not a time to enroll in A and B unless you're in your initial enrollment period. Okay, let's go on to the next one. So there's a general enrollment period. Now, this I hope none of you ever have to use, but for people who miss their initial enrollment period, they would need to use the general enrollment period, which is January through March, and enroll in A and B, and then the coverage would go effective in July. So let's go on to the next one. See, so that's this. Okay, there are a lot of special enrollment periods, tons of special enrollment periods. If you have a household move, you change states, or you just move outside the region of your Medicare Advantage plan, you've got a special enrollment period. Generally speaking, these are you always need to double check this stuff, but generally speaking, a couple of months to make a change. Get a plan that serves your area. So there's household move. There's if your plan doesn't renew, you'll have some. That's a special circumstance. If your plan doesn't, if your Medicare Advantage plan decides not to be in business for the coming year, then you have a chance to pick up a Medigap without medical underwriting, or to go into a different Medicare Advantage plan. If your extra help status, I'll go into this more later, gives you wider option for enrollment, and your Medicare, if you have a Medicare savings program or Medicaid, that's a different circumstance for your enrollment as well. Let's go to the next one. Okay, so All right, so this is one that I particularly wanted to mention. This is the next one. So there's a Medicare Advantage open enrollment period that was new in 2019. If you enter the new year, 2021, with a Medicare Advantage plan, you have a chance to change your mind during the first quarter of the year. So if you don't like it, your doctor let the network, whatever, doesn't matter what your reason is. You can make one change during that time. You can change to a different Medicare Advantage plan. If you change in January, if you enroll in January, it'll go effective in February. Enroll in February, it goes effective in March. Enroll in March, it goes effective in April. You can change your mind one time. The other thing you can do is you can, this is rare, but it's a possibility. You could, if you had gotten, if you decided you wanted to change to the Medigap profile, you wanted to have original A and B and standalone prescription drug plan and a Medigap controlling your spending limit, you could switch from a Medicare Advantage plan to a standalone prescription drug plan during that time. Don't do that unless you have it in writing that a Medigap insurer is going to give you a policy, to control your spending. All right, let's go on to the next slide. All right, so let's talk a little bit about, this is another confusion that comes up during open enrollment, is that the open enrollment period is not a time to change your Medigap. Okay. The Medigaps have not so much enrollment periods, but guaranteed issue periods. There are certain times when they have to sell it to you without medical underwriting. In other words, it doesn't matter your health, the state of your health, or what conditions you have. They're required to sell it to you. That's 6 months after you pick up Part B. And then there's some other special guaranteed issue periods, about 5 of them, that are the exceptions to that 6-month rule. So there's not an open enrollment period for Medigap policy per se. Now let's go on to the next slide, because there's a special deal. Okay, in Colorado, starting this year, and it's not going to go on. It's only this year. If you have a Plan F or a Plan C, and you want to get out of that and go to a Plan G, you can do that between January 2020 and end of June 2020. You've got a chance to do that. Sorry. So if this is your situation, if it's Plan F or a Plan C and it's a Colorado plan, you can, you're going to get a letter from, it's going to have from your insurer, actually, that shows that you have this coverage and advises you of your right to change from an F plan to a G plan without medical underwriting. Medical underwriting means that they ask you questions about your health, and if you have certain conditions, they can either raise your premium, they can impose a pre-existing wait period, or they can just flat refuse to sell it to you. Okay, so you have this ability. Now, G plans are less expensive than F plans, and they've always been less expensive. But there's some sense that since Plan Fs are no longer sold to new Medicare beneficiaries, that the G plans are going to become progressively less expensive than the Plan Fs. So many people are wanting to switch. This is your chance to do it. You don't have to stick with the same company. You can change companies. If it's a Colorado company, you can change companies. Also, if you happen to move, I don't know why you'd be listening to this if you were out of state, but if you happen to move from out of state with a Medigap plan that's from another state, and you come here you move here between January 1st and June 30th, then you can use this right as well. And Medigaps from other states can be considerably more expensive than Colorado. So California, for example, their rates are considerably higher than Colorado rates. So that's that's an option too. Okay, I think I'm done. Let's go to the next slide. All right, I'm not done. Okay, let's see. So in 2021, just a reminder, this is for people who have extra help, also known as low income subsidy. It used to be if you had that benefit, which is, it's a means tested benefit that helps with Part D costs, prescription drug costs. If you had that benefit, you had a month-to-month open enrollment. You know, way to make yourself miserable, but you had a lot of options for change during that. And that's changed. Now you still have more options for enrollment, but they're restricted. You can make one change during the winter quarter. You can make one change during the spring quarter. You can make one change during the summer quarter. And then during the fall quarter, these beneficiaries have to use the annual open enrollment period, and their policy would go, if they made a change, their policy would go effective January 1st, just like anybody else using the annual open enrollment period. Okay, next slide. So, all right. So insurance company do's and don'ts. Every year we get, people who are calling us, who are saying, that they've been approached by cold called by insurance agents, or they've been visited by an insurance agent who came to talk to them about one thing and then added on something else. Both of those are examples of agent misconduct. Also, another example is claiming that they're endorsed by CMS or Medicare or Department of Health and Human Services. So as a SHIP counselor, I have nothing against using an agent or broker. I would say, though, that you need to make sure that you find that person rather than them finding you, particularly cold call, because if they cold call you, then they've already committed agent misconduct. They may genuinely be an agent, but that's not a good way to start that relationship. So, that the SHIP is really good for the big picture, because we SHIP counselors don't care what company you go with. You could go from Kaiser or go with Cigna, go with United. It doesn't make any difference to us. Agents and brokers tend to specialize in certain companies, certain products. It tends to be like Kaiser. A Kaiser agent is just going to sell Kaiser. That's all. Then there are agents that sell, they're called brokers. They sell everything but Kaiser. And then there's some that are just dedicated to certain insurance companies. So just, for this, watch out for this relationship. It can be a very important one. You need to get it off on the right foot and not be compelled to, for example, to have somebody visit your home and come say they're going to talk to you about a Medigap and then try to transfer your annuity into their company. Okay, that's not allowed. And you can approach a SHIP counselor to help you report that if something like that happens to you. Okay, next slide. All right, last slide. So this is some information for you for how to get in contact with us. The top website is the SHIP website at DRCOG. The bottom website is if you need to find the SHIP in your area where you are, if you're in another state, you can go onto that website and find it. For the phone numbers, that top phone number is the local number to DRCOG SHIP. And the bottom number is the number from the Medicare U-Book that will, if you're in Douglas County, it will get you to DRCOG SHIP. Otherwise, it will get you to the one that's appropriate for your area. Okay, so that's all I have. And did anybody have any questions about that?
Hi, everyone. This is Luke Thornton, the host. If you have a question, you can raise your hand and I will call on you, or you can put the question into the chat box and send it to me directly. Going once. Any questions from our attendees? Going twice. Any questions from the attendees? All right, Jean, and Gretchen, I'm not seeing any questions coming in on chat or with hands raised. You're so efficient with your presentation that they don't have any questions.
Can I hope that's the reason. Can I say one more thing? You know, due to the coronavirus, we are working remotely. The DRCOG shift people are, I imagine they all are, but we're working remotely. So if you contact us on that main ship line, you will have to leave a message, and the person that calls you back is going to call from their work cell phone. So you know, so it's an additional complication in getting to us. So we just so far have not gotten the thing in place that rings us up as ship that's calling you. It's going to be a remote cell, and you can leave a message. If you leave a message for us, you can say, like one person said, make sure that you say that you're from ship, or make sure the one person had like a secret code they wanted us to use. You can do that if you want to, and just to clarify whether it's just a robocall or a genuine call. All right, that's all. Thank you.
All right, back to you, Gretchen.
Okay, well, thank you, Jean. I know there's so much to teach people about this. It's so complicated. And the SHIP program is near and dear to my heart. I was the SHIP director for the state of Ohio for 17 years. And I know how important you and your counselors are in helping folks faced with the sometimes overwhelming challenge of choosing the perfect health plan for themselves. So bravo to your team. And rest assured, our listeners, rest assured that this is a viable, objective, very caring group of people who have been trained by Medicare, so you can trust their help in sorting out all of this information. Now, since we're spending more time at home, especially during the upcoming colder months, many of us are turning to that social media to stay connected. And as Tiffany mentioned, we'll be having Joyce guide us next month on how to stay safer as we connect with others during this way. So please consider joining us on Thursday, December 3rd at 10 a.m. to learn more about this topic and keep ourselves safer. And meeting flyers will be going out later this month. So if you're on our email list, you'll be getting a flyer. Our November First Friday update will be going out tomorrow with additional information on this presentation in December, along with other items of interest. If you haven't already signed up for our electronic newsletter or would like to share your comments on today's meeting, send us an email at dcseniorlife@douglas.co.us. Again, that email address is dcseniorlife@douglas.co.us. A few more items before we close today. A reminder that we record our presentation. So if you'd like to hear Jean's presentation again, because there was a lot that she covered, or any of our earlier presentations, please visit our webpage, mydougcoseniorlife.com. Again, mydougcoseniorlife.com. Let your friends know about this opportunity too, because there's a lot of information not only Jean shared, but last month Dennis Del Pizzo from Medicare shared. It doesn't hurt to listen to it several different times and getting to know this information more thoroughly. We'd love you to have you comment on our Facebook page, which is My Doug Co Senior Life. Sound familiar? My Doug Co Senior Life. Or visit us on our YouTube channel as well. We appreciate you taking time to join us this morning and hope to be with you again next month. Until then, enjoy a blessed Thanksgiving holiday and stay healthy and stay connected. Bye now.